A new report raising fresh concerns about Obamacare. Investment firm Morgan Stanley saying its survey of 148 insurance brokers finds a sharp spike in insurance claim premiums for health plans sold directly to consumers. And they say it's largely due to the health care law. Senator Kelly Ayotte has been getting an earful about Obamacare from her constituents in New Hampshire, where that survey found a whopping 90% average rate increase of individual off-exchange plans. Senator, thank you so much for joining us on this. This is a remarkable number that we're looking at here. 90% in your state. What are you hearing from New Hampshireers?
Well, here's what I'm hearing from people in New Hampshire. In New Hampshire, there's only one insurer on the exchange. 10 of our 26 hospitals have been excluded from the exchange. So people in my state have written me about losing doctors that they've had a long-time relationship with, not being able to go to the hospital that they want to. And just a couple of examples. One family wrote me saying that they saw a 29% increase in their health insurance premiums. Another person wrote me saying that for his family, it was over $1,900 more a month for health insurance than what they were paying before. So people are writing me with these kinds of stories. So this obviously Morgan Stanley survey is quite troubling in terms of what the health insurance brokers have said for my state. Yeah. But I've also heard a lot of personal stories from New Hampshire about the impact of Obamacare.
By the way, your state's second only to Delaware, where premiums actually doubled. They went up 100%. And the average in the individual market was a 12% increase, according to this Morgan Stanley study. Now, I have to bring in the other side of this. According to the latest Gallup poll, it did show that the number of adults in this country without insurance has indeed dropped from 17% at the end of last year to about 15.5% at the end of March. So it appears that in line with the president's goals, more people are insured.
Well, here's the question. Why didn't they just deal with the uninsured instead of hurting everyone else and really having an impact on people that were satisfied with their policies? Because the people that I just talked about had policies that they were satisfied with, they were canceled, now they're paying more. And the other issue is with the enrollment numbers that the administration is claiming, you know, how many of those actually are uninsured or were uninsured before? We don't know the answer to that. But overall, it seems to me that we could have addressed the issue of the uninsured without changing insurance for everyone else, and also continuing to allow people to have the plans that they liked and keep them, and also, most importantly, the relationship with the doctors that they've had, so that people aren't forced to lose their physician.
Senator, what is the future of Obamacare as it stands today, especially based on what you're hearing in your own state?
Well, I actually think that Obamacare has huge problems. I certainly support repealing it and replacing it. But there are other issues as well, including it changes the 40-hour work week. It's now 30 hours in terms of who is included under Obamacare. I think that's a significant issue in terms of the hours that people could be working. I've gotten correspondence about that. So I think there are significant issues about this law. And in New Hampshire, again, one insurer on the exchange, 10 of 26 hospitals excluded. So people who have had long-time relationships with hospitals, and most importantly, the physicians at those hospitals, are impacted by this law in New Hampshire. So less choice.
Do you plan to talk to the president about the fact that you've seen average premium increases of 90% in your state?
Well, I would hope that the administration is looking at this survey and taking it to heart, because one of the issues that we need to look at as well, the administration keeps delaying the law for politically convenient reasons. One of the delays to stay tuned on is that we'll get a better sense of the insurance rate increases because of the law. When insurers report their rates this spring, they have delayed the open enrollment date, so from October 15th to November 15th, which conveniently is 1 month after the election. So again, the administration, I hope, is taking this to heart, but they've had so many politically convenient delays that I think is wrong.
Senator Kelly Ayotte from New Hampshire, thank you so much for joining us.